Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. I'd like to extend also a warm welcome to our viewers from Westchester and Hudson Valley tonight. Well, tonight we have a doctor from Catholic Health Services to help you sort through what's going on with COVID-19 in our communities and across the region. And we always want to hear from you. Call us at the number at the bottom of your screen, 516-393-1800. All right, let's get right to the numbers here. Governor Cuomo today said coronavirus deaths across the state hit a record high for a third day in a row, 799 new fatalities. Now, while the number of deaths is climbing, the rate of new cases is starting to level off. However, the governor warns we cannot relax yet. He said the loss of life is shocking, painful, and breathtaking. Now, across the state, the death toll now stands at, look at that, more than 7,000. The deadly pandemic has taken the lives of almost 1,000 Long Islanders. Suffolk Executive Malone called the latest fatality numbers horrific. He said he never, ever imagined he'd be reporting this number of fatalities on a daily basis and seeing those numbers go up every day. And in Westchester, more than 350 people have died from COVID-19. Now, while the hospitalizations are slowing, the numbers of those infected, that keeps rising, and it's likely due to increased testing. The state confirmed cases stand at a little under 160,000 right now. Now, Long Island, including both Nassau and Suffolk counties, has upwards of 37,000 positive cases for COVID-19. Westchester now just a little more than 17,000. You can see the numbers right there. Now, a surge in the number of New Yorkers seeking jobless benefits. That has actually crashed the state system right now. Officials are working right now to fix that problem. The state's website will be down this evening. A new, more streamlined one will be put up in place, we're told. Officials say they're actually working with Google right now to come up with a better solution. And they say benefits are retroactive, so even if you can't sign up right away, you will still get the same amount of money. That's going to be all retroactive. Now, quarantine respite for many, that's been temporarily taken away again. This is a little bit of bad news, lighthearted bad news. Golf courses now added to the New York State COVID-19 non-essential business list. The governor's ordered all local courses shut down, at least until April 29th. And New York's Black and Hispanic communities, they're being hit the hardest by the virus. A point driven home today, again, by the governor. He said additional testing sites would be open in predominantly Black and Latino neighborhoods, and he wants to address the higher fatality rates in those areas. And some grocery stores and other retailers, they're making new changes you should be known about. They're aimed at keeping shoppers safe. Now, Stop and Shop, King Cullen, even Walmart, they're all restricting the store aisles to one-way traffic. They're also limiting the number of shoppers in the stores as part of a social distancing effort to help stop the spread of the coronavirus. You might see some lines outside, and that's why. All right, joining us now tonight, Dr. Patrick O'Shaughnessy. He's a Catholic Health Services Vice President, Chief Clinical Officer, and at this point, a friend to the show. We appreciate your time coming on here multiple times with how busy you are right now. Let me ask you, start off by asking you just how are you doing and how are your colleagues doing and holding up?
Stone, thank you for asking. We're doing well. Look, it's not an easy time, but in healthcare, and we have a team of amazing healthcare professionals and supportive team members at Catholic Health Services. We're holding up. You know, I always say it's a marathon. It's not a sprint. This is not something that's going to go away in a week. So we've got a great response going on now, and we're really taking steps to make sure we keep our teams safe. And we also create a mechanism for longevity so that, you know, we give folks now starting to get them some breaks, cycle people on and off teams, and bring in some additional help. That's going to be crucial to get through this.
Yeah, and you're all doing an amazing job, and we all appreciate that. As part of your job, let me ask you this, as part of your job is also just to match resources with the needs. How are the resources right now as far as throughout the system?
Yeah, my colleagues will tease and call me on the Care Traffic Control Center. That's a big piece of my job. So we try to match resources to where they're needed most. We're very fortunate at Catholic Health Services. We're a 6-hospital system here on Long Island. We care for over 25% of the population. So a good chunk of my time working with my colleagues at the hospitals and at the system level is moving resources around. So if we have a particular situation where we're have a surge of patients that need intensive care services at one particular entity, and we've got open beds in another, we'll shift them there. If we have challenges around personal protective equipment, we can move that very quickly. Even ventilators, move those very quickly. Now, fortunately, we're doing well. I think thanks to the efforts of the governor and others at FEMA, we've received additional supplies. We've received additional ventilators. So we don't have any, immediate shortages. But again, it's a marathon, not a sprint. We need to make sure we're ready for the long haul.
Okay. All right. Let's go straight to the phone lines. We have a lot of people already waiting. Jim from East Patchogue. Jim, you there?
Yes, I'm here.
What's your question tonight?
My question is, my wife's had a fever since Sunday. We called up the Department of Health to see, we want to get her checked out and everything. And the problem is we haven't heard back. And I know they're busy and everything like that. The thing is, she's on blood pressure medicine now. Is she more susceptible to this coronavirus?
So again, Jim, if you're saying your wife has a history of hypertension, she's on medication, chronic disease can make some people more susceptible to having a more severe reaction to being infected with corona. I would suggest, get a visit. I mean, we have telemedicine at CHSE Visit. Any healthcare system also offers these services. You can go in, call, get seen. You could also get screened through an urgent care center as well. I think it's great that you're proactive and you're reaching out to the Department of Health, but reach out to your healthcare professional right off the bat and see if you can get her seen. That would be my next advice to you.
Okay. Mario from Huntington Station. Mario? Mario, you there?
Yes, I'm here.
What's your question tonight?
Yeah, my question was that my daughter is pregnant. She gets the virus, and I want to know what she has to do.
She has a virus?
Yes, there's coronavirus.
Okay, she's been diagnosed with it?
Yes.
And what she should do? Well, doctor, I'll let you take that.
Yeah, sure. So again, very hard without knowing all of her, the background, her age, risk factors, and all of that situation. Again, my advice clinically would be for her to get evaluated by her healthcare provider, whoever that may be. And if she does not have a healthcare provider and she is sick, urgent care first, or possibly an emergency room if need be. So again, without knowing all of the details, make sure you're under the advice of a physician. 80% of people still will do fine and be able to recover at home. But again, without knowing all the specifics, I'm an ER doc by training. So I always think worst case scenario, I want to make sure you're safe. So if in doubt, if you have questions, reach out to your doctor or seek care in one of the local urgent care centers. I know the neighborhood well. I live in not far from you. There are wonderful different sites that you can choose to go get seen.
Okay. Would it complicate anything if she were pregnant?
Again, in general, what we've seen relative to coronavirus, not necessarily true at this point. Now, in general, we know if someone is pregnant, it does make them more at risk for other types of complications relative to other infectious etiologies. So far, we haven't seen that with coronavirus. But again, I always err on the side of caution stone, and I would advise people getting at least screened through one of the mechanisms I've described.
Okay. Harvey from Syosset. Harvey?
Yes, thank you. Thank you for taking my call. I want to talk about fever. What is considered a fever as a symptom of this particular virus, and does it depend on the type of thermometer you use?
That's a really good question. So let me address it this way. Where we're taught in medical school and our nurses are taught in nursing school, fever is defined as temperature greater than 100.4 degrees Fahrenheit. So that's what defines a fever. However, what we've seen, even with sometimes in cases of coronavirus, sometimes you could subjectively just feel warm. You could have what has been, I would say, called probably inappropriately so, but a low-grade fever, or someone who's around 100 degrees. Remember, normal body temperature, 98.6. So there are some degrees of variation in how temperatures are taken. I won't get into all of the graphic details on how that could be. It could be temporal scan, it could be oral, and there are other ways as well that we check core temperature, which are very important when someone's really sick. So I would tell you either oral temperature check or even the temporal scans are really accurate. They can give you a sense of whether or not you have fever. And if you do, with some of the other symptoms of some body aches and cough or respiratory symptoms, you should get yourself screened.
Doctor, let me ask you this. I know that there are conflicting reports out there. Some federal officials are touting hydroxychloroquine as a potential prophylactic measure that people can take. Would you recommend, if people could get their hands on it, for them to take that or not?
So again, I know there's been a lot of buzz in the media around hydroxychloroquine. which is one of the off-label drugs that has been used to treat coronavirus. It is not a magic bullet. In fact, none of the medications are. They are off-label uses, which means we don't have large random controlled trials to show that they confer definitive benefit. What we've seen is anecdotal or case-related evidence that they do help. Now, at this time, the literature still supports using those medications really only for inpatient care. Now, I know there have been case reports and others out in the field that have had good success with people that are, Stone, to your question, of a very mild disease status. Now, remember, the medications themselves are very safe, but you do want to make sure you don't have any cardiac issues. And I don't want to get into all the details. It's really related to making sure you don't develop an arrhythmia. So we should make sure that you're safe, number one, first, do no harm. And generally, we recommend those medications be saved for the evaluation in an inpatient setting.
Okay, I think we have time to get the question out before we take a break, and maybe not have time to answer it, but let me get to Scott from Wading River. Scott? Are you there, Scott? Scott, are you there?
Yes, I'm here. I'm sorry.
Oh, what's your question?
Yes, thanks for taking the call. On yesterday's broadcast, there were several conditions listed that place people at an increased risk of mortality if they contract the coronavirus. I believe among them were coronary artery disease, hyperlipidemia, diabetes, and hypertension. Now, for someone who has one or a combination of medication or treatment, is the risk of mortality just as high as if left untreated, or does that risk decrease in proportion to the success of the treatment?
Okay, that's a great question, Scott. We're going to take a real quick break. I'm going to let the doctor think about that over the break, and we're going to come back with more. We're going to give you some more expert advice on how to keep you and your family safe from the coronavirus. Again, we want to hear from you, so call us with your questions. The number right there is 516-393-1800. If it's busy, just keep trying. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in the doctor, Dr. Patrick O'Shaughnessy, the Catholic Health Services Vice President and Chief Clinical Officer. Now, we still have Scott from Wading River on the line. He asked a question right before the break about having multiple chronic conditions.
So Scott asked a really good question, and his question, if I understood it correctly, was, hey, if you have these multiple medical issues such as hypertension, diabetes, and they're well controlled, are you potentially at less risk of complications than someone who has them and is not well managed? And I think the true answer to his question, unfortunately, is going to be, we'll know at when this is all over and we actually get to look at all of the data. However, I would say that I would agree with him. I actually think this is what we may be seeing in some of the underserved population. You know, I'm very passionate about population health and making sure that everybody has access to care and gets the care they need. And as the governor mentioned in one of his press briefings, unfortunately, we're beginning to see that some populations are having higher degrees of mortality and morbidity, such as African Americans, Hispanics. And I think that that's related to what we say it's more zip codes than gene codes, right? So it's where you live. Do you have access to care? Are you taking medicines? Are you well cared for? So definitively, from a medical scientific perspective, we'll have to see how the data shakes out. And certainly if you're well controlled, if you're seeing your doctor, if you're taking all your medications, even though you have those conditions, you're likely at a lesser risk than someone who is uncontrolled.
Okay. Christian from Massapequa Park. Christian?
Hey, thank you, News 12, and thank you, Dr. O'Shaughnessy, for the time. My fiance Jillian and I had a baby on April 5th. We wanted to know when it would be socially acceptable for our parents and loved ones to come and see Liliana.
Well, first of all, congratulations on the birth of your daughter. Beautiful, amazing time. I remember when we had our daughter. So born April 5th, so really, really, young. And at this point, we get very concerned given transmissibility, right? So again, my recommendation would probably be, usually when you get to be about 4 weeks of age, there's a little bit less risk in terms of passage of anything that could be potentially contagious, meaning the baby has a little bit more immunity. Remember, when the baby's born, a lot of times there's a lot of passive immunity that comes through the placenta, giving the baby a temporary boost. But my wife will tell you, when we brought our daughter home, literally, I kept people out of the house that were sick for a month, and we're in the middle of a pandemic with corona. So I know it's probably not the news you want to hear, but for the next few weeks, I would play it safe. Could always consult your pediatrician and do what we're doing right now, which is not a substitute for being there in person, but video conferencing and whatnot. So I'd play it safe for the next few weeks and consult your pediatrician.
All right. Maureen from Floral Park.
Yes, I'm here.
What's your question, Mike?
I have multiple chronic illnesses, but the thing that I'm most concerned with is I take high doses of steroids, and I'm actually currently cushingoid from that. And I have developed some symptoms. I started out not with the normal things like the cough. I don't run a high fever. I've always had a low fever, and then the steroids keep that low anyway.
Yes.
I started out more with nausea, abdominal type symptoms, and now I'm having some of the shortness of breath and a little bit of the cough as well, but the extreme fatigue and the chills and that kind of thing. Could that be COVID, and should I be getting checked?
Yeah, I would advise you to get checked right away. I mean, you nailed it, and that is because of your medical condition and you're on corticosteroids, your body is not going to mount the same immune response. So I wouldn't be alarmed, but I would get yourself checked and I would get yourself tested. And again, the major indicator for me is once folks start displaying symptoms of shortness of breath is when, I have a heightened degree of concern and I want to make sure we know what's going on. So I definitely would get on the phone, maybe get a televisit going on, speak to your healthcare provider, and I think that's the most prudent next step for you.
Yeah, Maureen, stay safe. Good luck with that.
Stay safe.
Susan from Seaford. Susan?
Hi. So my question with this pandemic going on, what are the professionals doing for the homeless population? Are they testing them? Are they just waiting for them to come in to be checked? How are the homeless population being taken care of?
That's a tough situation, yeah.
It is a tough situation, and it is a really, I think, significant, public health problem, not just on Long Island, but, certainly in New York City. So I'm probably not the best source of truth relative from a public health perspective. I will tell you that we do outreach at Catholic Health. Our emergency rooms, we call them islands of hope. If people need access to care, we don't turn anybody away. We want to make sure we care for everybody. So that is something that I know in meetings that I've been on with both county executives, who, by the way, I think they're doing a wonderful job. They're looking to address all of those needs, looking at how do we continue to manage folks who are homeless? How do we get them access to testing? How do we get them access for care? Mental health as well. We, again, with everything being shut down, it's hard for people to get access to care so readily. So I know that this is being looked at, and I know that they're looking at special steps and ways in which we can make sure that we offer folks who are homeless or perhaps need behavioral health services or other community benefits in a manner that's safe with the condition that we're in. It's certainly a challenge.
Yeah, and it's also complicated with the undocumented population as well. That's also a very complicated issue. We're going to take another quick break. We're going to keep the doctor around for one more section, so keep it right here. You're watching our coronavirus pandemic special report. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Patrick O'Shaughnessy from Catholic Health Services. We had a caller during the break. I was just talking to the caller. We don't really have time for him to come on, but his name is George from St. James. His question, I'll let you answer it. I'll just try to reiterate it. His question is, if he's wearing gloves and he goes into his vehicle, takes the gloves off, and then drives around and maybe puts it in a garbage bag, can the virus, if it's infected, can it somehow get into the air inside of his vehicle?
I mean, it's a good question and it's a valid concern, but the answer is likely no. And as I think we talked about the last time I was with you, Stone, there's a way to take your gloves off, which is really important, and that's called doffing in medical terms, and how you remove them. So when you take your gloves off, you should take you're actually flipping them inside out, right? So you take your one glove off inside out, tuck it in the other one, and pull the other one off so it contains what was facing on the outside. It's wrapped and contained on the inside. That's what we do in the medical world. Again, as we take our gloves off, put them in a bag and be fine. And even if you didn't do that, the overall likelihood that something would be transmitted the way that the caller's questioner would be very, very low. I wouldn't be concerned about it, but it's a good question.
Okay, you just gave me a great idea. We're going to have you next time you're on. If you could show us, give us a demonstration with those gloves, that would be. I think it would be great for viewers, since so many of us. I even have a pair in my office that we're all wearing gloves and masks right now. That's really all the time we have. I just want to say at the end of this segment, thank you and your colleagues for everything you're doing. You really are the heroes here on Long Island, and I know all Long Islanders. We all just throw our love your way. You really are doing such a phenomenal job, and we thank you. So thank you very, very much.
No, they're the heroes, not me. They're doing a great job, and thank you for the opportunity to share some information with the viewers.
All right, and thank you to the viewers and everyone who has questions. We'll be back tomorrow night at 7. I'm Stone Grissom. Good night.